So my first patient has a number of prescribed oral medications as part of her plan of care.
Good. I'll observe you as you prepare the medication.
Okay.
Now, keeping in mind what we discussed earlier, what was the first step?
Well, first I checked the original medication order on the chart with the medication administration record. That's when I clarified any inconsistencies and noted any allergies she has to make sure she's not allergic to any of the prescribed medications.
That's correct. And don't forget
The 3 checks and the 5 rights.
Okay. All right. Now, start by unlocking the med card. Very good. And remember, we only prepare medications for one patient at a time. And in addition to checking the medication's expiration date and calculating the dosage, you should also take care to separate any medications that require special considerations or assessments.
So, according to the MAR, my patient's first medication is 1 multivitamin tablet, PO, or by mouth daily. So I pick the appropriate package out of her medication drawer.
Right. Now that's check 1. Now check 2 is to compare the package label to the MAR again.
Okay, so should the unit wrapper be opened now or when you give it to the patient?
Well, the medication should remain in the unit dose wrapper until it is given to the patient.
Okay. Next is 0.125 milligrams of Lanoxin PO daily.
Check 1.
Check 2 is to compare the medication label again to the medication administration record.
Okay. Very good. You're exactly right in placing this Lanoxin in a separate cup because before this medication can be administered, you'll have to check the patient's apical pulse rate for 1 minute.
Right.
Good.
And according to the order, I should withhold the medication if the apical rate is less than 60.
And if it's less than 60, we notify the physician.
Okay.
Okay.
So the last medication she needs is 20 milligrams of furosemide.
Okay. Can you get that out? Okay.
And check 2. The furosemide can be placed in the same cup with the multivitamin because, according to her chart, her blood pressure and serum potassium levels are within normal levels.
Yes. Yes, they are. Good.
Okay, so these are all the medications that she needs at this time.
Now, after all the medications for the patient have been prepared, you should check the 5 rights for the 3rd time before taking the medications to the patient. So let's do that now. Good.
Okay.
Good. There we go. And don't forget to lock the card.
Okay.
Very good.
All right, we're all set.
Let's go see the patient. Good.